Please be seated. Good morning and welcome to the December 2015 College of Nursing Commencement. I am Rita Franz, Dean of the College of Nursing, and I want to extend an especially warm welcome to the family of our graduates. I know that the room is filled with parents, siblings, grandparents, and extended family and friends. We're so pleased that you could join us to bear witness to the accomplishment of our graduates. We have been most privileged and grateful to have as part of our community, your family members' life has added to the joy we share today. The entire university community shares in your pride and happiness on this very special day. Assisting us with these ceremonies this morning are, to my right, Dr. Ellen Cram, the Associate Dean for Undergraduate Programs, Executive Associate Dean, Dr. Thad Wilson, and the person who will be conferring the degrees today is Vice President for Research and Economic Development for the University of Iowa, Dan Reed. I also want to recognize our student marshal who led the students into the ceremonies. She is Nicole Kalupik. Amy Ruth McGraw is our sign language interpreter for this morning, and Johanna Thoskak is our pianist. For the graduates, today marks a milestone of achievement on their journey along the path to professional nursing. Today, you, the graduates, will transition from student to professional nurse. Reflecting back on this journey, it began with a vision of being here today. Along your voyage, you have worked hard, encountered a few setbacks, and experienced great joys. Your relentless efforts and sacrifices have paid off. Today, you join an elite group of professional nurses. You will be distinguished as Iowa nurses. This distinction marks you as a professional nurse of the highest integrity, who has the competence, compassion, and confidence to lead the discipline of nursing into the future. While none of us can predict exactly what the future holds, we can be certain that healthcare will change in both incremental and significant ways. In the near term, the new healthcare laws identify great challenges in the management of chronic conditions, primary care, including care coordination and transitional care, disease prevention and wellness, as well as prevention of adverse events such as acquired infections. Most of these near-term challenges speak to the traditional and current strengths of the nursing profession in such areas as care coordination, health promotion, and quality improvement. How well nurses are educated and do their jobs is inextricably tied to most of the healthcare quality measures that have been targeted for improvement over the past few years. Thus, for nursing, the challenges of healthcare reform provide an opportunity for the profession to meet the demand for safe, high-quality, patient-centered, and equitable healthcare services, and for a reformed and better integrated healthcare system. Your baccalaureate degree in nursing has armed you with the critical scientific knowledge and decision-making skills to transform the healthcare system for the foreseeable future. You can become a shaper of change. Embrace this incredible opportunity. As you embark on your nursing careers, I challenge you to make a difference in our healthcare system. Through your willingness to seek new knowledge about best practices and evidence-based care, through your capacity to look for gaps in your own clinical practice and in the healthcare system and address them through innovative solutions, and through a skill set that emphasizes critical thinking and treating the whole patient. Your deep-seated commitment to clinical excellence makes us proud to have you as our graduates. We congratulate you on your accomplishments, and we welcome you to the profession of nursing. Now, out here in the audience, there are many people that have made this day possible for our graduates. Many of family and friends are here who have been a source of ongoing support and encouragement to these graduates. So graduates, would you please stand and face out towards all these special people and join me in a round of applause for all these important people who have made this day possible. Thank you. Guiding students to acquire the skills and competencies of a professional nurse requires the expertise of highly dedicated mentors. Please join me in recognizing the representatives from the faculty whose efforts have led these graduates to a professional nursing career. Faculty, would you please stand so that we can acknowledge you? Thank you. Okay. It's now my pleasure to introduce Jessica Underwood, who will be speaking on behalf of the 2015 BSN class. Jessica came to the College of Nursing as a second-degree student. Following graduation from Thomas Downing High School in Modesto, California in 2003, she completed a Bachelor of Arts degree in choral music education at California State University, Northridge in 2009. Jessica was drawn to pursue a nursing degree through her experience as a 7-year-old, when she was deeply influenced by a nurse who cared for her in a pediatric intensive care unit. This childhood experience ignited a passion to advocate for individuals' health and quality of life, especially for those who are most vulnerable. Jessica views a nursing career as the means to fulfill this passion. While pursuing her BSN, she has been awarded numerous scholarships, including the Hearst Foundation Nursing Scholarship and the Dr. Jan Lee College of Nursing Scholarship. She has also received 2 years of funding from the U.S. Department of Health and Human Services as a Nurse Corps Scholar in exchange for a 2-year service commitment to provide nursing care in an underserved community following her graduation. Jessica enriched her undergraduate program through participation in the Honors Program, the Young Pediatric Clinician Program, and through volunteering in the University of Iowa Mobile Clinic. Following graduation, She plans to work in an underserved community as a Nurse Corps scholar. Ultimately, she hopes to earn a doctorate of nursing practice and become a pediatric or neonatal nurse practitioner in a children's hospital. In the meantime, Jessica and her husband will be welcoming their first child this coming February. Ladies and gentlemen, please welcome our BSN speaker, Jessica Underwood.
Good morning. I just want to say it is such an honor to stand before you all in celebration of my beloved BSN graduating class. These are some of the brightest, most hardworking and compassionate people I have come to know in my 2 years at Iowa. I have a sneaking suspicion that I am mostly standing here because my classmates thought it might be fun to see how I, a pregnant woman, might safely maneuver the stairs and stand at the podium for more than a few minutes without passing out. But luckily I wore my compression stockings today, and I've forgiven you all for your lapse in nursing judgment. So before I explain what has happened over the past couple of years that we have all gone missing, I want to thank you all, our family, our friends, mentors, and faculty, for supporting us in your countless ways in a most challenging and rewarding time in our lives. I don't know how you put up with us, but you did, and now here we are, asking you to put up with us for a little bit longer as we attempt to pass our boards and make our very exciting progression into the nursing profession. We are very fortunate to have you, so thank you. 4.5 years ago, the majority of my classmates went off to college, and they had a few simple responsibilities: to learn things and try stuff. And I want to congratulate them for accomplishing those tasks while managing to stay alive, and even more impressive, setting themselves apart from the majority of their peers. They learned to sacrifice their social lives early on in their college career. Or as Emily Wolney puts it best, they closed down the library more than they closed down the bars. They made these sacrifices because they carried a deeper sense of purpose in their hearts, to care for people. I truly admire them for their maturity and their sense of purpose at such a young age. Fast forward 2.5 years, and we all met for the first time under the same roof for nursing orientation. Wide-eyed, excited, a little bit terrified, but full of hope. We were so proud to identify ourselves as the December 2015 nursing cohort. A few of us brought with us prior degrees and careers and varying backgrounds, but we became unified by our common desire to serve others. After our white coat ceremony, where we proudly declared our commitment to the nursing profession, we learned quickly the weight of that commitment, as in the 160 pages of reading in our 300 pounds of textbooks before classes even began. Our first semester struck us like a train. I call it the Health Assessment ATI Pharm Clin Sim Pathology Care Plan Clinical Calc train. This was our heaviest semester academically. We struggled to come to terms with NCLEX-style nursing exams, in which we were told to choose the answer that is most correct, when in reality they were all correct. We began to experience signs and symptoms of the diseases that we were learning about in pathology, which would only get worse as we took psychiatric nursing. And we became all too familiar with the 5 stages of grief as we received our first exam scores in health assessment and pharmacology. Thanks. Performance exams induced some serious anxiety for some of us, but Peg and Darlene always had a way of making us feel better about the career path we had chosen, as long as we remembered to use good hand hygiene and to leave our patients with the wise words of Darlene. Is there anything else I can help you with? I have the time. Our second semester marked the beginning of our clinical rotations, that special day in every nursing student's life where we get to finally take care of real people. It was our very first time dealing with loose bowels, sweat, vomit, difficulty breathing, and that was just us before we entered our first patient room. And while some of us may have been naturals in applying hands-on nursing skills, most of us learned that the human anatomy is nothing like the mannequins in our simulation lab, specifically the female anatomy when trying to place a urinary catheter. At times, we felt defeated in our weak stomachs, our clumsiness, and in our mistakes. But we pushed forward because we were determined and we were together. The semesters flew by, and before we knew it, we began to see ourselves transforming into baby nurses. Dr. Prater helped us to focus less on our grades and more on the awesome nurses that we were becoming. While Todd and his soothing and caring voice not only taught us compassion for those who struggle with mental illness, but also managed to boost our mental health along the way. Outside of the classroom, we encountered many joys and some hardships with our patients and in our personal lives. Together, we celebrated these joys and we comforted each other in our sorrows. And through it all, we became further bonded as a class. We learned from our patients how to be courageous and resilient, and most importantly, the value of looking beyond their illness and into their hearts. It is my hope that each of us will remember these incredible times. Pregnancy hormones, I swear. I hope we will remember these incredible times that we shared together at Iowa, and that these memories, the strong bonds that we formed with each other and our patients, will carry us through times of difficulty, uncertainty, inspiration, and celebration. It is these relationships, after all, that have taught us the value of the human connection and what nursing is truly all about. So, congratulations, BSN graduating class. I'm so proud of us all. I can't wait to see how far we will go. Best of luck.
Thank you so much, Jessica. Among the graduates who will be recognized today are those who completed their initial preparation for nursing at a community college and subsequently enrolled at the University of Iowa to pursue a bachelor's degree through a special program tailored to their unique learning needs. Courses are offered online, over the internet, and practicum experiences are coordinated by faculty located in regional centers across the state. For some of these graduates, this is the only time they have come to the University of Iowa campus since their initial day of orientation. Speaking on behalf of the RN BSN graduates is Carrie Dorn. Carrie graduated from Maple Grove Senior High School in 2007 and earned an associate degree in nursing from North Iowa Area Community College in Mason City. She's been employed as a registered nurse on surgical services at Mercy Medical Center of North Iowa for nearly 5 years. While pursuing her bachelor's degree in nursing, Carrie has been engaged in multiple volunteer activities within the Mason City community, including Special Olympics, Sharing and Caring Hands, and the Susan G. Komen Foundation's activities to support breast cancer research. Following graduation, Carrie plans to continue working at Mercy Medical Center of North Iowa. She will also be continuing her education next year at the University of Cincinnati, pursuing graduate preparation as a nurse practitioner in end-of-life hospice care. Ladies and gentlemen, please welcome our RN BSN class speaker, Carrie Dorn.
First off, I'd just like to thank Jess for that wonderful speech. I'm not pregnant, but I probably will cry. And obviously, thank you to Dean Franz for that introduction. I'd first like to take the time to acknowledge the people that got us to this point, because without you, none of this would be possible. Thank you to professors, some of you who are even mentors. Thank you for answering questions over and over again that were probably clearly spelt out in our syllabus. Also, thank you to our family and friends. Thank you for being that shoulder to cry on. Thank you for listening to all of our bickering and how we had so much homework and we'd never get it done. But I guess somehow we managed to. Also, I'd like to take the time to thank my fellow classmates. It's been an absolute honor to have taken this journey with you, and oh, what a journey it has been. But that doesn't matter now. What matters is that we're here now together. This is happening. As I stand here before you, let's just be honest. I'm very nervous. My heart's beating around 120 beats per minute, so I have a bit of tachycardia. But I guess if I have code blue, I'm in the right room of people, right? I knew there was a reason I took speech online, but I guess I'm making up for it now. But I think of everything I have accomplished in becoming a nurse, and I guess what's one more speech? So thank you for that honor. It's been said that the Bachelor of Science in Nursing is one of the toughest degrees to obtain. What were we thinking? But when your nursing school is ranked as one of the best nursing schools in the nation, you go for it, to better yourself and to better care for your patients. Whether you have been a nurse for a few short years or have been a seasoned nurse of 20 plus years, we all had to take that leap of faith and apply for our BSN program after obtaining our nursing license. Like Dean Franz said, many of us in this room have never actually met before, but we've only seen each other's faces many months ago during orientation. But in this group of 64 nurses, some of who are not here today, I feel privileged to be part of such a distinguished and accomplished group of individuals. Whether you're a part-time or a full-time student in the nursing program, we all know how time-consuming those class sessions can be. During our last week of class, we had to post our resume and cover letters that we would present to future employees. I was in awe of the accomplishments, achievements, awards, and experiences of these students that I was surrounded by. Without naming any names, our graduating class has experience in hospice, acute care, ER, endoscopy, surgical, cardiac, oncology, critical care, float nurse, home care, school nurse, mental health, traveling nurses, pediatric, labor and delivery, OB, nurse managers, supervisors, directors, been preceptors for nurses in training, published research articles, even carried out their own research projects, all while still having time to apply and be recipients of multiple scholarships, put in endless hours of volunteer, and have a 4.0 GPA average. Whew. Wow. Like I said, this group is such a notable group of individuals, and even though I have not met all of you personally, I have learned more than I could have ever imagined. From you, I have learned that the most important lessons in nursing do not come from a textbook, but they came by gaining experiences from my fellow nurses who have made mistakes and are vulnerable enough to share them with me. So thank you from the bottom of my heart. During the first week of class, we had to share, the basic introduction information. It became clear that all of us share the same guilty pleasure, Netflix. And ironically, most of us share the same love for Grey's Anatomy. One of the best episodes is when the doctors talk about the one. The one could either be that one person we went to in a time of struggle when we were feeling overwhelmed or stressed, who we depended on to get us through. Thanks, Krista, for being my one. The doctors also talk about the one person, that one person who we see in every patient we care for, the one person who we see that makes us into the nurses we are today. Or how about the one time we realized we knew that this is what we were born to do? I still remember the time my family received a phone call that forever changed our lives. The petrifying changes I saw my mom endure during her breast cancer journey jolted at my heart. The physical and emotional challenges that I saw my family endure was only so little, but from something so devastating turned into something so beautiful. As I watched the healthcare professionals care for my mom, I had the feeling I was born to do this career. No one could ever take that away from us when we realized the one time we knew we wanted to be a nurse. Now I want to talk to you about that one nursing school that made us into the nurses we are today. That nursing school is the University of Iowa for all of us. This nursing program has given us the best gift, knowledge. Nelson Mandela said it perfectly. Education is the most powerful weapon we have for changing the world. Through our semesters, we have learned the importance of continuing our education and how there is no limit to bettering yourself with knowledge. Putting our well-earned knowledge to work, we can better utilize evidence-based practice to guide us in making better decisions for our patients' care and changing our healthcare world. Thanks, University of Iowa, for being our one. Before I leave you here today, I want to remind you all of something that I know during those hard times will remind you of what you are capable of. We are professional nurse leaders, using our gained knowledge and experience to grow and make a difference in the lives we touch with trust, strength, and peace. Tomorrow, we'll go back to our normal lives, some of us even having to work 8, 12, 24-hour shifts. But never lose sight of the tiniest of details, find magic in even the smallest inspirations, and embrace even the briefest moments. That's our passion. That's why we do what we do. Congrats, class of 2015.
Thank you, Carrie. We are pleased to have with us today, for the conferring of degrees, Vice President for Research and Economic Development, Dan Reed. Professor Reed was appointed Vice President for Research and Economic Development of the University of Iowa in the fall of 2012. He holds a university chair in computational science and bioinformatics, and is a professor of computer science, electrical and computer engineering, and medicine. Vice President Reed is the ultimate techie, having previously served as Microsoft Corporation's Vice President for Technology Policy and Extreme Computing, where he helped shape Microsoft's long-term vision for technology innovations in cloud computing and outlined the company's associated policy engagement with government and institutions around the world. He served as a member of the President's Council of Advisors on Science and Technology and the President's Information Technology Advisory Committee. Please join me in welcoming Vice President Reed.
My privilege and my honor to welcome all of you today on behalf of the University of Iowa as we celebrate the success of our graduates. As Dean France noted, the world is changing in dramatic ways, socially, technically, politically, and certainly in the nature of what it means to provide health care. Those of you who are parents remember when books didn't need batteries and phones were always connected to the wall. The patients that our nursing graduates will treat know a world where that was never true. The technology we have today allows us to cure a disease that was unimaginable even a decade ago. And so it's in that bright new world that our graduates address the future. It's true politically as well as we think about the changes afforded by the Affordable Care Act and the privatization of Medicaid. Those will bring profound changes to the nature of healthcare itself. And yet for all of the social and the economic and technical and biomedical change that we've seen over the past decades, there's some things that are eternal, that define the nature of what nursing is about. The fear and uncertainty of the young and the old as they face illness, the longing for comfort and care and wisdom when hope is sometimes fading. And of course, above all, the desire for rapid, efficient, and effective and accessible high-quality care. But with all due respect to all of the other aspects of the healthcare professions, nurses play a critical, unique, and special role because beyond just the technical expertise they bring to bear to those who are ill or in need, you're the human face in a very special way of healthcare. It's heart and soul. You see individuals at their weakest and their worst, at the youngest and the most aged, at the beginning and at the end of life. And it's in your words and actions that you touch people's lives in such deep and enduring ways. And as nurses, you define what it means to be human each and every day. And so I have no doubt an Iowa nursing education has prepared you for the future, to think about needs and approaches, to learn always new skills and techniques across a lifetime, and to act with compassion and with alacrity, with knowledge and with skill. So in that spirit, let me leave you with one brief thought from the poet Maya Angelou. She said, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." And so let me say on behalf of all of the University of Iowa, and I know all of you family and friends out here, and on behalf of the faculty, I know how we feel today. We feel extraordinarily proud of you. Your Iowa nurses. Celebrate that fact forever. Congratulations.
Will the candidates for the degree of Bachelor of Science in Nursing please rise? Vice President Reed, these candidates, having completed all the requirements for the degree Bachelor of Science in Nursing, are recommended to you by the faculty of the College of Nursing for the conferring of this degree.
Dean Franz, on recommendation of the faculty of the College of Nursing, and by the authority vested in me by the State Board of Regents, I confer on each of you the degree Bachelor of Science in Nursing as qualified and designated.
The turning of the tassel is the tradition of gesture by which each student signifies passage from degree candidate to graduate. Now, before we recognize each of you individually, please mark your new status as graduates of the University of Iowa College of Nursing by moving the tassel of your cap from the right side to the left. There you go. Will the graduates please be seated?
It's my pleasure at this point in time to begin the recognition of those who have earned the Bachelor of Science in Nursing. So with the first row, please rise and come forward. Thank you. Oh, really slow. Grace McCammett, Bachelor of Science in Nursing with honors in nursing. Amy Walker, Bachelor of Science in Nursing. Erica Drapeau, Bachelor of Science in Nursing. Ellen Stansfield, Bachelor of Science in Nursing. Miranda Carlson, Bachelor of Science in Nursing with honors in nursing. Ivy Huber, Bachelor of Science in Nursing. Brooke Nintgen, Bachelor of Science in Nursing. Sarah Armstrong, Bachelor of Science in Nursing with honors in nursing. Jessica Jasper, Bachelor of Science in Nursing with honors in nursing. Haley Rath, Bachelor of Science in Nursing with honors in nursing. Amy Woods, Bachelor of Science in Nursing. Hannah Burdell, Bachelor of Science in Nursing. Jessica Paulson, Bachelor of Science in Nursing with honors in nursing and with highest distinction. Elise Goodwin, Bachelor of Science in Nursing with honors in nursing. Brittany Bergfeld, Bachelor of Science in Nursing with honors in nursing. Jessica Gatehouse, Bachelor of Science in Nursing with honors in nursing. Bailey Ford, Bachelor of Science in Nursing with honors in nursing. Stephanie Speck, Bachelor of Science in Nursing. Caitlin Burke, Bachelor of Science in Nursing with honors in nursing and with highest distinction. Angela Platt, Bachelor of Science in Nursing. Erin Van Dyke, Bachelor of Science in Nursing. Sarah Cunningham, Bachelor of Science in Nursing. Samantha Bernholtz, Bachelor of Science in Nursing. Kelsey Kelker, Bachelor of Science in Nursing. Janet Cordova, Bachelor of Science in Nursing. Alejandra Gonzalez, Bachelor of Science in Nursing. Jennifer Paulson, Bachelor of Science in Nursing. Haley McCoy, Bachelor of Science in Nursing. Mallory McKay, Bachelor of Science in Nursing. Alyssa Brunel, Bachelor of Science in Nursing. Kylie Cripps, Bachelor of Science in Nursing. Andrea Rose, Bachelor of Science in Nursing. Shelby Smith, Bachelor of Science in Nursing. Amanda Childs, Bachelor of Science in Nursing. Taylor Goggin, Bachelor of Science in Nursing with nursing honors and with highest distinction. Tom Mahoney, with Bachelor of Science in Nursing with honors in nursing. Nicole Berkowitz, Bachelor of Science in Nursing. Jennifer Gray, Bachelor of Science in Nursing. Emily Wolney, Bachelor of Science in Nursing. Emma Cook, Bachelor of Science in Nursing with honors in nursing with distinction. Cassandra Glidden, Bachelor of Science in Nursing. Anna Motika, Bachelor of Science in Nursing with honors in nursing with highest distinction. Erlyn Joy Calma Santiago, Bachelor of Science in Nursing. Jessica Marie Underwood, Bachelor of Science in Nursing with honors in nursing. Aubrey Boltz, Bachelor of Science in Nursing. Kylie June Collins, Bachelor of Science in Nursing with honors in nursing. Dansha Lee, Bachelor of Science in Nursing. Morgan Quinnett, Bachelor of Science in Nursing with honors in nursing. Taylor Cool, Bachelor of Science in Nursing. Megan Seibel, Bachelor of Science in Nursing. Andrea Sanchez, Bachelor of Science in Nursing. Jamie Prioletti, Bachelor of Science in Nursing. Joshua Ship, Bachelor of Science in Nursing. Tyler Landvid, Bachelor of Science in Nursing. John Labernick, Bachelor of Science in Nursing. Daniel Handler, Bachelor of Science in Nursing with honors in nursing. Isaac Butler, Bachelor of Science in Nursing with honors in nursing with highest distinction. Cynthia Amajan, Bachelor of Science in Nursing. Mary Smith Riggs, Bachelor of Science in Nursing. Tim Saunders, Bachelor of Science in Nursing. Jordan Edmondson, Bachelor of Science in Nursing. Lindsay Johansson, Bachelor of Science in Nursing. Brittany Donald, Bachelor of Science in Nursing. Mary Hatfield, Bachelor of Science in Nursing. Jana Galbraith, Bachelor of Science in Nursing. Angela Dudley, Bachelor of Science in Nursing. Jennifer Webker, Bachelor of Science in Nursing. Dana Marie Conley, Bachelor of Science in Nursing. Tamara Michelson, Bachelor of Science in Nursing with honors in nursing. Stacy Toole Crawford, Bachelor of Science in Nursing. Laura Benabose, Bachelor of Science in Nursing. Kelly Dutemeyer, Bachelor of Science in Nursing with honors in nursing. Crystal Liebhart, Bachelor of Science in Nursing. Jenna Burke, Bachelor of Science in Nursing. Ashley Spurgeon, Bachelor of Science in Nursing. Jenna Hunter, Bachelor of Science in Nursing. Amy Worley, Bachelor of Science in Nursing. Krista Grutz, Bachelor of Science in Nursing. Carrie Dorn, Bachelor of Science in Nursing. Jennifer Gast, Bachelor of Science in Nursing. Rachel Wolken, Bachelor of Science in Nursing. Sarah Walker, Bachelor of Science in Nursing with highest distinction. Rochelle Pitzenberger, Bachelor of Science in Nursing with highest distinction. Amy Eastman, Bachelor of Science in Nursing. Alicia Dentlinger, Bachelor of Science in Nursing. Amanda Melvin, Bachelor of Science in Nursing. Lisa Goodale, Bachelor of Science in Nursing. Lori Labarge, Bachelor of Science in Nursing. Tanya Fordyce, Bachelor of Science in Nursing. Erin Mahoney, Bachelor of Science in Nursing. Catherine Fordyce, Bachelor of Science in Nursing. Kayla Kaiser, Bachelor of Science in Nursing. Ladies and gentlemen, let us join together in offering our heartiest congratulations to these, the newest Bachelor of Science in Nursing graduates from the University of Iowa College of Nursing.
This weekend, you, the graduates, will leave the College of Nursing and start new roles in the profession of nursing. Start out by aiming high. Along with the faculty, I have great hopes for you, our graduates. I hope you find true meaning, contentment, and passion in your life. I hope that you navigate the hard times and you come out with greater strength and resolve. And I hope that whatever balance you seek, you find it with your eyes wide open. And I hope that you have the ambition to take charge of the healthcare world, because it desperately needs you to manage it. Now, that's a big challenge and a pretty daunting task, but you can do it. And know that we will be watching and cheering you on. Congratulations and best wishes to all of our 2015 College of Nursing graduates. Will the marshal please come forward? And will the graduates please rise for the recessional? And will the audience please remain seated until the graduates, faculty representatives, and platform party have exited?